Good morning and welcome to the Point. This marks the 5th week that we will devote this show, at least most of it, to a discussion about health care, and we're happy to have with us Congressman Pete Hoekstra. Over the last 4 weeks, we've had both of our U.S. senators, Senator Carlin, Senator Debbie Stabenow. We had our panel to talk about policy and just the way policy impacts, and Congressman Vern Ehlers. So as we come into this 5th week, the last week before Congress heads back to Washington.
Congratulations. Getting the senators is better than their constituents were able to do.
Well, we're going to talk about that because you're talking about town halls, and the senators did not hold them, nor have all but one other member of Congress. Congressman John Dingell did hold a town hall meeting over in his district. You have been holding some town hall meetings talking about health care. First of all, let's talk about those, and let's talk about the lack of other town hall meetings. You've had them in your district in Cadillac. Did you have one in Ludington, one in Holland? You have some others scheduled. Tell me, how did they go? Because we've seen on television, the national television, about almost shoe-throwing incidents. How were yours?
I thought they were very civil. People do speak passionately about this issue. But very civil, and every once in a while someone would stand up and they'd make a particular comment. You get a little bit of booing or hissing or some applause, and you just kind of, hey, tap it down. Let's have a civil discussion here. Let's not lose control of this. But great interest. 1,000 people turned out in Holland. And I thought they were very, very worthwhile.
When you have these kind of discussions, and I was thinking about this in terms of the discussions leading up to the war in Iraq. There were many people that were very passionate and that were very opposed to the war in Iraq, particularly as it continued.
Sure.
The war in Iraq continues even today, despite that opposition. When you look at this health care conversation, you've seen a lot of people on both sides. At your town hall meetings, I think most of the people were opposed to the language or what they perceived to be the language. Right. In our form of government, we have a representative democracy. You and 434 other members over in the House and 100 over in the Senate are elected by people to make decisions. Are those decisions necessarily guided by these kind of town hall meetings, or do members have to come to the conclusion that they have to look at the greater good?
Well, I think they're influenced by both. I think, sure, you go into a town hall meeting and you get the kind of response that I think many of us have seen over the month of August. It's going to have an impact. But then at the same time, you also have to take a look at the larger issue and recognize that people would say, I don't want to pay for someone else's health care. You kind of say, you already are. A hospital like Holland right now has 20% uncompensated care, meaning that it's charity care. Well, someone else is picking up that expense because that hospital can't continue to run on those kinds of numbers. So it is picked up. But that's what you can also do in the town hall meetings, where you've got an opportunity where people will say that. You say, no, let's discuss this. We're already paying for it. Let's move through it. So you hope that the town hall meetings, people come in with passion, you have discussion, you all leave having learned something more, and that is what representative government is about. You need to have that face-to-face contact with the people. A lot of other members have, they've done the telephone town halls, they've done TV town halls and those types of things. They all help. But nothing can replace being in a room with 1,000 of your constituents and having to, and having willingly, and I enjoyed it, listening to what they have to say for 2.5 hours.
As a practical matter, too, and maybe more of a political matter, how important is it, and you are not, as I should point out, running for re-election to Congress, and that you are a candidate for governor. We are going to have all of the candidates on for governor. This is not a discussion about that. But as a political matter, how important is it for people to see their representatives in those kind of forums? Because a lot of times people just want to vent.
And that's okay. Venting is healthy. It's healthy through the process. People want to be heard, and what I've seen now is they especially want to be heard on this issue because it is a personal issue. It's about their health care. It's about the health care of their parents, who may be elderly. It's about seniors worrying about, what kind of care am I going to get for the next 6, 10, 15 years? And then we worry about what's this going to do to our kids. Will they have the same kind of quality health care that we've had? So you recognize some people are coming in, they're looking for answers to questions. You got some people who just want to vent. and then you've got a very, very few, that just want to create a controversy and something sensational. You put that all in the context, but by and large, the town hall meetings are, I think, a very good investment.
Well, this has been controversial. It has been passionate. Let's talk about it a little bit. Let's begin with this health care conversation. H.R. 3200 is over in the House. It is the bill that has gone through the 3 germane committees and would be ready to go, as you were explaining to me earlier, to the Rules Committee, if that's what they choose to do when you go back this coming week. That bill, as it stands, I take it, does not have your support.
It does not. I voted against it in committee. There's a lot of ambiguity in the bill. 187 times it says the commissioner shall. That means that it's 187 times Congress took a pass. We didn't make the call. We didn't make the decision. We really don't know what the cost is going to be. But bottom line is that bill starts with the premise that we're not going to start with you or me controlling and setting the direction for health care or the health insurance that we're going to have. It starts with the premise that a bureaucracy or a bureaucrat or this new health commissioner in Washington, D.C., they're going to set the framework for the kinds of choices that we are going to have and the kind of costs that you and I are going to pay. We lose control. We turn it over to a bureaucracy in Washington. I think that's the wrong way to go at it.
When you talk about this bill, and as I said, we had both U.S. senators here, and they talked about some of the things that they would like to see. One of them is a public option. A public option, according to some, would lead to virtually everybody being forced into a federal government program. According to those people who support it, they say no. This is an option for competition, so people have a choice in this exchange or in this co-op. Your take on the public option?
We've done that. We did this in 1993, 1994. People looked at the student loan program. My colleagues on the other side of the aisle said, we got to hold those banks accountable. We got to put a public option in place. It was called direct student loans, direct lending. It's only there to keep these guys honest. This president now, 15 years later, in his budget proposal, we've now moved this through our committee, said, what do we need the private sector banks for? We have a government option here. It's only gotten 15, 18, 20% of the total market, but, it's cheaper than these banks and all of that. So they're proposing getting rid of all private sector lending for student loans. That's exactly what's going to happen here. The other thing is you can't structure competition with the government. The government always wins. In direct student loans, they don't count all the overhead. They don't count the fact that the default rate for federal student loans is higher than it is for the private sector. They don't include those things in, and that's why they come up that the government option is cheaper. You can't compete with government. These folks want all of us on a public plan. This is the camel's nose under the tent. We know where they want to go. John Dingell, for 54 years, has been fighting for a single-payer system. This is an incremental step for where he wants to go and where he wants to end up. You put a public option in place, the politicians in Washington will make it so difficult for the private sector to compete that eventually the private sector, they use this statement attributed to Newt Gingrich. In this case, the private sector will wither on the vine and will go away.
When you look at health care in America, you, I believe, said in one of your town hall meetings that you thought reform was necessary.
Sure, absolutely.
But clearly, H.R. 3200 is not the kind of reform that you would favor, at least large portions of it aren't. And I should point out that you are on one of the committees that went through what's called the markup. You've gone through the bill, so you've had the opportunity to have hands-on and look at it. I've read the bill. It's difficult for anybody who isn't immersed in Washington to read any of these bills and come away with a real clear sense of what they mean. Even the congressional research folks are a little ambiguous about what some of this means. What kind of impact do you believe H.R. 3200, knowing almost certainly it will not end up being passed as it is written, what impact would it have beyond the public option?
Well, it would have huge impact. I mean, this is about taking 18% of the economy. So Washington would decide where that 18% of the economy would come from, trillions of dollars, who would pay it, and then Washington would decide who it's going to be distributed to. So we would all end up basically on a public health care system. It may take a decade to get there, but that's eventually where we would go. But it would be a massive shift of control Again, away from you directing how your dollars would be spent, how much you would pay to Washington, and having it being shifted over to Washington, D.C. I think it would have an impact on the quality of the care that we receive. A place like Mayo, recognized globally as if you get sick, man, go to Mayo. What does Mayo believe that this does to their cutting-edge approach to health care, where they're constantly innovating, constantly experimenting, constantly improving their practices, and then disseminating that information around America, but around the world? Mayo comes out and says, this is disastrous. We are totally opposed to this, because I think they see and they recognize that putting the heavy hand of government over on healthcare is going to eliminate innovation. It's it's going to eliminate an area where we still dominate the world on health care, and we're going to lose that edge. And so they're saying we don't want any part of this.
When we come back, we're going to talk about a number of things. One of the issues that has been talked about is that the healthcare system is broken. Mm-hmm. And maybe the statement that some of those people wanted to make was that the healthcare insurance system is broken. We're going to talk about that. We're also going to talk about people who aren't covered currently and what happens as we move forward in a Congress that is dominated by Democrats and a party that has said that they want some type of healthcare reform. We'll find out about all of that with Congressman Pete Hoekstra when we return to The Point. Welcome back to The Point. Our guest is Congressman Pete Hoekstra. We're talking health care, fifth week in a row. It's probably the subject we devoted more complete shows on than perhaps the state budget or the run-up to the war in Iraq or some of the aftermath there. But this is one of the biggest issues that you'll be dealing with in your career on Capitol Hill. Senators Levin and Stabenow were here over the past couple of weeks, and they talked about the need to get coverage for people who don't have that coverage. Congressman Ehlers, in his visit, reminded us that numbers are variable, that there are different numbers floating around, but there are millions of people in this country that do not have health insurance. There is a consensus of a lot of folks that there ought to be some way for them to get health insurance. First of all, should they be able to get health insurance, and what role should the government play in that?
Yeah, I think everybody agrees that there needs to be reform. And as we've gone through the town hall meetings, people have said, the largest applause line is we need tort reform to address some of the cost issues in health care. And then what you need to do is you need to address accessibility, more competition, more insurance companies, more plans in the marketplace. And you need to deal with pre-existing conditions, so people can't be excluded from the market simply because they've got a pre-existing condition. And then the issue of cost for, in many cases, it's the working poor, people who make too much money to qualify for Medicaid, and we can do that with tax subsidies. We can do that with other forms of subsidies or credits. And so I think everybody believes and recognizes that those 4 or 5 things are key things that probably you could get a majority of Republicans and Democrats to agree on to incrementally improve the current system and get it done a whole lot quicker. Remember, the bill that the president's talking about, those reforms don't even kick in for 5 years. The program doesn't start. These are 5 things we could do in the next 3 to 6 months and begin improving the current system right now.
When you talk about things like pre-existing conditions, that begins the conversation. But there's also the question of portability. There's the question of being denied service. There's the question of being dropped from your carrier. All of these things, one way or the other, sound like government is going to reach way into the private sector business. Is that something that Republicans can really go along with?
Oh, I think so. Because we already reach way in, or the medical profession does. When the medical profession says, if you come to the hospital's door, you come to the emergency room, the doctors and the federal government say, you will be treated, you will receive treatment, you will receive care. Later on, we will figure out how we're going to pay for it. To actually improve the system so that all people are covered by health insurance, hopefully now moves those people from going in and accessing health care at the most expensive point in the process to a more reasonable point. So the government's already there. The question is, how are we going to reshape that to make it more effective, more efficient, and more fair?
People have talked about the cost being $1 trillion over the next 10 years, and the fact of the matter is, and I say this with respect as you sit here, that very often people in Washington greatly underestimate the cost of everything that they do, because it's hard to know how much things are going to cost. Is cost the real issue when it comes to health care reform, given the amount of money that's been spent at the end of the through the Bush administration, through the prosecution of 2 wars, through bailing out banks, through the Obama administration, and a big stimulus package? Is cost really an effective argument in this? Is this really more about policy than money?
No, it's about how do we design a system that is more effective in cost. All right, so it costs, whether it's cost containment, cost management, or whatever, that has to be an issue. We're talking about 18% of our economy, and the plan that's out there now, people are saying, this is going to be $500 billion taken away from Medicare. That's cost for seniors, and that money is going to be moved to taking care of the uninsured right now. Well, this has huge implications for the care of our seniors and those types of things. So, no, cost very much has to be a discussion, part of the discussion as we move forward.
Let's talk about the politics. Let's talk about the numbers.
Okay.
If the Democrats in the House of Representatives wanted to patch H.R. 3200 or any other bill that they come up with, Republicans don't even have to show up.
That's right. I mean, and there are, Nancy Pelosi at times during the month of August has said, I'm going to do a public option. I don't really care what the town hall meetings have said. Barney Frank has said it's nothing. These folks are nothing more than AstroTurf. They don't represent the American people. Damn the torpedoes, full speed ahead. We're going to pass this bill, and we're going to pass it by the end of September. That's what they were saying at the beginning of August. That's what some of them were still saying at the middle of August. I think when Speaker Pelosi comes back and meets with her Democratic caucus, and if she outlines that kind of a strategy, she may have her head handed to her on a platter. That's not where I think her caucus is going to allow her to go as much as she would like to go there. I don't think she can go there. I think that she's got too many districts that from conservative districts who are going to say, we ain't going there. We're not going to support you. Come back, rein this in, and let's do this together. Talk to me a little bit about the procedure. We talked a bit about this before we went on the air. 3 committees that needed to take a look at this have looked at it. They passed it, including the Education Committee that you're a member of. It would go, if they wanted to move it, it would go to the Rules Committee. And this bill, and again, understanding that the Senate doesn't have a bill put together, it's likely not going to be the same bill that the House comes up with, or at least right now it doesn't sound like it. This bill, as it's written, could change considerably or could be completely substituted in the Rules Committee. The Rules Committee can draft a totally new piece of legislation. So I encourage your viewers who are very interested in this issue, watch the Rules Committee, see how much the bill changes, what the content is of the bill coming out of committee, but then also how much time is the Rules Committee going to give us to take a look at this new bill before we actually have to vote on it. I mean, the bill that we passed at the end of August out of the committees, we're finding as we go through the month that there's all kinds of things in there that we didn't know. $10 billion for VEBA, the UAW retirement fund. That may or may not be good policy, but it shouldn't be in the health care bill. There were tax provisions that were inserted, ironically enough, by the chairman of the committee, Charlie Rangel, for folks who, in good faith, estimated or paid their taxes but made some mistakes, and his policies, we're going to hammer you. The interesting thing is, this is a guy that's being investigated by the Ethics Committee for not necessarily being all that truthful with his taxes. But again, we found that out, or people found that out 3 weeks after the bill went through these committees. What's in the bill that comes out of the Rules Committee? How long do we have to take a look at it and study it and try to understand it? Will it be a day or less than a day like we had with cap and trade, where they added in 400 pages? Nobody knew it was in cap and trade, yet it passed the House of Representatives. Then we wait for the Senate, then we wait for a conference committee. There's a lot of opportunities in here yet for people to create mischief, meaning change the bill, change it at the last minute, and put it on the floor of the House or put it on the floor of the Senate for a vote. What happens over in the House? Again, Democrats have a large majority, and even without some of the so-called blue dog Democrats, they probably have votes that they could put up on some of this. But what happens over in the House if something like this gets passed out and it goes over to the Senate? Is it your sense that the Senate, where Democrats also have a pretty good majority and could change some rules to be able to push things through pretty quickly, is it your sense that the Senate is going to try to mirror what's happening in the House, or are they going to come up with something that looks different? I think that the Senate, if you're looking for what's going to happen in health care reform, I wouldn't necessarily look at the House all that much. Speaker Pelosi, her colleagues, they're way too far to the left, and they don't represent, I don't think they represent the American people. They also don't represent the compromise or the position of where the U.S. Senate is. I think that real reform will be driven by what comes out of the Senate. There are at least on this issue, then it's hard to compliment the U.S. Senate, but they're going to be the more rational body. They're the collegial body that is going to look for a compromise that more people can accept, that has a better chance of being a bipartisan driven process. Nancy Pelosi is driving this as a partisan issue. There are those in the Senate who are trying to make this a bipartisan issue, that when we get done, we may not all like what's in it, but it will have made significant progress in addressing the problems and the issues that are out there.
As this goes further and further, the president wanted this done before the August break. Obviously, it didn't get done. And again, and I pointed out a number of times to a number of the folks who have emailed me, who have talked about the absolutes in this bill. Quite frankly, there are no absolutes at this point, because this is still pretty fluid. Yes, there is a written document, but we don't even know what the interpretation of some of that document may be, and the implementation of that particular document is not likely, because there are going to be changes that go forward. But as this goes further, if it goes into October, if it goes into November, does it become more or less likely that there is health care reform that gets done?
Well, I think a lot of that is going to be determined by the tone that the president sets in 3 days. What's he going to say on Wednesday night? Is he going to say, I want this and I want it now and I'm not going to make a lot of compromise? I think that could be the death knell for health care reform if he continues pushing his narrow partisan agenda. If he comes back and says, I'm pushing the reset button, I want to do this on a bipartisan basis, he really may open up the door. It may take a little bit longer. But I don't think the other one would ever happen. It may take a while, but it says, I want to do this on a bipartisan basis. I want 60% of the Democrats to vote for this bill. I want 40% of the Republicans to vote for this bill. I want a bipartisan bill. He could get that done. We could move that forward. And it's hard, but the legislative process was never intended to be easy. But I think he would set a very different tone in Washington, and I think deliver on the promise that many of us were expecting when he went into office in January, that he would change the tone. So that's why I think a lot of us are going to be sitting in the chamber on Wednesday night and seeing exactly what tone this president is going to set. And I think the speech on Wednesday night may not only set the tone for the health care debate, it may set the tone for the rest of his presidency this first term.
We are virtually out of time. Real quickly before we go, with all of the other variables in there, some type of health care reform ultimately gets his signature.
I sure hope so. It needs to happen.
All right, Congressman Pete Hoekstra, thank you as always for being here.